Hi, I'm Helen Smith and I'm a consultant forensic psychiatrist at Langton Hospital. I moved down from Birmingham to Devon in 2004 and started working in this directorate in 2005. I absolutely love working in this environment. So working at Langton, for me, is all about having fantastic colleagues. So there's a really cohesive medical body here. Having a really good group of colleagues that you can talk about anything to, seek support from, discuss cases with, is incredibly important. The most important thing is I absolutely love my patients that I work with. They're just an amazingly sparky and complicated, complex group of individuals. The reason that I love it so much is the complexity of the people that we support. And with the team, there's just an amazing opportunity to really work alongside people, to really deeply understand who they are as people and what their problems are, and then build a complicated, holistic package of care. Ultimately, we want to move people back into the community who are in charge of their illness and in charge of themselves such that they can get on with the lives that they want to live. The most rewarding element of my job is undoubtedly seeing people progress, and I've always very strongly recognised that people progress at different speeds. So I get equal amounts of joy from somebody who's very unwell and very complicated getting out to the greenhouse to grow a tomato plant as I do to somebody starting an open university course. Despite us doing a serious job, this is a fun place to work and there's always somebody you can go and have a conversation with, even in tricky times. I have a large family and for me getting my work-life balance was incredibly important. I wanted to work part-time. That was never an issue coming to DPT. I was openly welcomed for the skills that I brought rather than the hours that I could work. As a medical leader, I have been the part-time clinical director of this service. I was also medical director for nearly 10 years. The majority of that time was on a part-time basis. As a woman, I have never felt discriminated against or undervalued. In fact, quite the opposite, actually openly welcomed. I think that within this service, our medical workforce in particular is extremely diverse here, and that brings absolute added bonuses to the practice that we partake. One of the other aspects of DPT that I have very highly valued is their support in taking roles outside of this organisation. I currently lead the National Mental Health Safety Improvement Programme for NHSI, but I also do work for the South West Academic Health Science Network. We as a family made the choice to come down to Devon because we're a large family and we wanted to bring our children up in a beautiful environment. I have many favourite places in Devon. I enjoy kayaking on the river and out at sea, beautiful walks. Equally, I love culture, so I love going to the cinema and to the theatre and to museums, and all of those activities are easily accessible from where I live in the countryside. I would choose DPT above other trusts in the country because for me it has offered the opportunity to be the best I could possibly be in the job that I love at the same time as balancing my family life and living in an incredibly beautiful place. I have never regretted a day of the job that I do.